Hey everyone, this is Gentrix. I'm responding to question 3 of group work, whereby we are with Julian in group 1, whereby we have been asked to prepare a speech addressing the issue of the cultural aspect in Kenya, and also addressing on the issue about the stigma surrounding mental health prevention, mental health diagnosis and treatment, and also about the mental health financing. First, I will start talking about and discussing about the issue about the cultural aspect that is surrounding the issue about the mental health. In Kenya, people define mental illness and associate it with different factors, being caused with different factors. One of them is about the witchcraft, and the one's about the curse, and the one they can say that people is full of evil spirits. That's what they're not thinking, right? Another thing they associate mental illness with whereby a person maybe went against the cultural norms or the cultural rules, such as killing someone. So by witchcraft, they see it that there's something that was done in an individual that affected their thinking ability, that affected them affect their well-being, that has caused them to become mentally ill, that has caused them not to think straight as others and work normally. Another thing is about the curse. They believe that mental illness came out because of certain curse that was put in a certain lineage that is following everyone in that lineage, that was maybe done by their ancestors, that whenever a person becomes sick, whenever a person starts behaving not in a normal way, they see it and they realize that what their grandparent or anyone did in the community is the thing that is affecting them always. Another thing, mental health is associated with the misconduct. Maybe a person went against the social norms of the culture, such as maybe killing someone or just doing anything that the culture doesn't accept. It may lead them to have the mental ill. So about the cultural aspect, mental illness is being associated with a lot of things, and it's being treated by stigma and discrimination, whereby if a person happened to suffer from this mental illness, they're being neglected and isolated within the community, whereby some of them, they treat them as the outcasts. They treat them as people who are not supposed to belong in the community. They see mental illness as something that can be transferred from one generation to another. So whereby you get that when an individual happens to suffer from this mental illness, they're being chased away from the community, they're being thrown away to the forest or anywhere else. Such that you get that most of them end up being committing suicide, and also others, you see them along the street. They're always everywhere until you wonder, is there a family, do they have a family that take care of them? But to get now, their family are afraid of what the judgment or about how people will see them. So you get that mental illness in our community, it is being treated as something bad. Nobody should suffer from it. So whereby you get anybody who happen to suffer from it, they're being isolated, chased away from the community. And some community when a person becomes mentally ill, first they use some herbs. They don't take a person to the hospital because they see that mental illness doesn't need any medical attention. So the first thing, they give herbs. When herbs doesn't work out, they take them to the witch doctor, whereby there are different things that are being tried on a person. Another thing also, they take them to prayers. So when they've tried everything to an individual and nothing's happening, a person is not healing up, they decide to chase them or they decide to neglect that individual. And some end up committing suicide because there's no support system upon them. But we thank God about the COVID-19 pandemic, which however much it affected people's job, it affected people's family, there's family breakout. People end up into depression, people lost their job. So that boredness, loneliness, yeah. So with this COVID-19 pandemic, it also brought a big impact on mental health aspect, whereby it drew people attention to put their focus also in mental health. They become curious. What is this mental health? They want to learn about it. They treated stress as a normal thing, but now it is affecting them, it's affecting their daily activity. They cannot work. A person thinking capacity has been affected. They cannot think straight. Everything just ran out. So it brought a lot of focus where people want to know, what is this mental health? They referred people with mental illness as mad people. So they wonder, like, if a person become mad, must that person get attention, a medical attention. So people with COVID-19 pandemic, people are becoming curious to learn about the mental health issues, and the government has really worked hard to create the awareness about mental health, whereby the first thing about the government has come out with their mental health action plan, whereby they're trying to strengthening the system of mental health aspect. And also they've come out with the bill of the finance to support the mental health thing, so that they can be able to strengthen it and bring out the productivity on mental health facilities or in mental health areas. And also there's the construction of mental unit, especially in hospital like level 4 and level 5. You'll get that when you go there, there's a mental unit. At least there's somewhere a conducive environment and a safer environment, whereby when a person is mentally ill or that needs attention, at least they have somewhere, but it's not yet enough. But the government is trying their level best to build more building, to build more facilities in order to treat mental illness as a normal illness. And this is being done by, they're trying to break out this issue about the stigma, about the issue of discrimination that's affecting the community, whereby the victim who is suffering from mental illness is coming from, and also the health providers who are taking care of them. They're also facing those challenges of the stigma and discrimination. So the government is trying their level best to sensitize also the community, and this is being done by the organization that have come out, the community-based organization. An example I can give of us, our TINADA. TINADA Youth Organization is based in Kisumu, whereby our main focus is about the mental health. The most thing we do is about sensitizing the community about mental health. We help the community to understand what this mental health is, what are the causes, how do you identify a person is mentally ill, how will you identify a person suffering from any mental health problem, which direction should you take, which path should you take as an individual, the importance of counseling sessions. So you'll get that most organizations that are coming up, they're working hard to try their best to sensitize and make the community aware of this mental health thing, to help the community treat the mental health thing as a normal disease, as a normal illness that needs the same attention, that needs the same support system, that also need that care that is being given to other diseases. So with this organization, the government is really working hard to support even the organization by giving out the donors. The donors are coming out to support them. And in Kenya so far, mental health is now becoming normal to everyone. People are able to understand what this mental health is. However, there are some communities but still struggle. But people are really working hard to work on these issues of mental health, work hard to break down this issue about stigma, work hard to break this about discrimination. And with the help of the government, come out with the facilities or training, with the courses that have come out in our educational sectors, whereby there are mental health courses that are being provided. People are being taught about, trained about it, and able to be equipped by skills and knowledge on how to manage any mental health problem. And with this, you get that most hospital people are becoming aware of it. The clinicians are aware of it, that whenever they encounter a patient who is suffering from this mental, they have a right path to follow. They know where to refer them and where they can get help. So with diagnosis and treatment, we have assessment tools that are used in the hospital to diagnose someone, to be able to know this person is suffering from what. If it is depression, there's assessment tool they use. If a person is addicted on drugs, maybe they're suffering from substance-induced disorder, they're able to know which medication to give out. So the government, with the help of the professionals, the medication are here out. However, they're expensive, but they're there. When people are depressed, they're being given antidepressant medication. When people are suffering from psychotic, like schizophrenia, they're being given antipsychotic disorder. They're given any person who's suffering from any disease that a person is suffering, there's a medication over it. And so far, so good. Our government is working hard to strengthen the mental health system. Thank you.